how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. David Selzer, NYU Langone Medical Associates. They have a practice on 101 North Clematis Street, Suite 110 in West Palm Beach. Their number's 561-365-3000. And you can check out Dr. Selzer on nyumc.org. And you were just saying, Dr. Selzer, you guys also have a location in Delray now.
Yes.
Delray Beach.
Delray Beach. We have 2 offices.
That's great.
As I live in Boca, it's great that I'm a little closer to my home a few days a week. I'm there Monday mornings and Fridays. We also have a nurse practitioner that's there Wednesday mornings. And hopefully soon the other practitioner in our practice, Dr. Tom Rockland, should be there Tuesday, Thursdays, but that's pending. Hopefully it'll help us handle the influx of northerners that we expect to come to Florida over the next few months.
That's great. Yeah, we're getting ready for our season here, and it's great that NYU Medical Associates is actually expanding in this area because you and Dr. Rockland are great physicians. I'm so lucky to have you stop by the show a few times. And you are a kidney and diabetes specialist as well. You're not only a division of general internal medicine, but you did a rare fellowship in kidney studies for a few years, correct?
Yes, I did a fellowship in kidney disease at Lenox Hill Hospital in the Upper East Side of Manhattan. It was really a great experience. It taught me to think critically and to ask myself, is this really appropriate? I always remember my fellowship director, Dr. Maria DeVita, and she would always tell me, pause and ask yourself, does this make sense? And she would always challenge us to not just know nephrology, but general internal medicine, because her approach was that the more you know about the more varied differences that are happening in a patient's care, the more you can ask yourself, does this make sense? Is this appropriate? So for that training, I always do appreciate it. And it gave me that kidney background to help me understand how medications interact in the human body. So I was very appreciative that I did it. And now that I'm here with NYU Langone, we're taking a general internal medicine approach, and we're trying to build up our practice.
And I didn't put this on the show notes, but I wanted to ask you, I'm going to put you on the spot here, though. Okay. But I didn't know what diabetes was until a few years ago, to be honest with you, even at my size. And you don't really look until maybe a family member has it or whatnot. But diabetes, I'm learning, it affects all different kinds of systems in the body. It's not just a foot ulcer. It's not just issue with blood sugar, insulin. It can start in a way, it can attack the kidneys or affect the kidneys in a way and other systems of the body, diabetes?
So I think it's interesting to know how diabetes works and what we mean when we're talking about sugars and insulin and what is going on. So when a patient is diabetic, they're having a problem with getting the glucose into the cell. So that's when we talk about your sugar is high and your sugar is low. The problem is the body has cells, and it has we call it the intervascular space and the extravascular space. So inside the cell and outside the cell. When the sugar is outside the cell and can't get inside the cell, it's usually because of a decreased amount of insulin inside the body. Okay?
Okay.
So as internal medicine doctors, endocrinologists, nephrologists, our goal is to lower that sugar. Now, there's different ways to approach it. You can increase the insulin, so that will that we can either stimulate the pancreas by and sort of pushing the pancreas to make more insulin, or we can give insulin directly, which is how it's treated all the time when you're dealing with the type 1, or we can slow the body's ability to make sugar. So there's different approaches of how we're going to attack the problem of getting the sugar into the cells and out of the body's extravascular space. So we'll just start with that concept. So when a patient comes who has type 2 diabetes, which is your more, how do we say, quote unquote, normal way of getting diabetes.
Yeah, I've heard that term a lot.
You know, type 1 is an autoimmune disease. It generally, not all the time, presents in younger patients. It's generally first treated by pediatricians and then by endocrinologists. But let's talk about your typical 55 to 75-year-old patient who comes in, they're a little overweight within reason, and they have diabetes and they have a family history, and we're trying to lower their sugar content. So the first step we do is we try to advise a patient to eat healthier, to diet, exercise more. If that doesn't work, your first medication in any physician's armamentarium is to reach for metformin. It's the gold standard of your treatment. It's available in Publix in the South Florida region, either for free or almost nominal amount of money.
That's good news.
It actually has
In
an
a way.
anorexigenic effect and it helps patients lose weight.
Oh, that's good too.
It's not actually considered a weight loss medication because it doesn't make patients lose weight to what we call the 5% barrier of their weight loss. So it's not technically a weight loss medication, but patients generally tend to lose weight while they're on metformin. And then comes the $64,000 question of the hemoglobin A1C, which is a marker of how well your sugar is controlled, is elevated. Even despite taking metformin, what is what we call your number 2 drug? Where are you going to? So in my education and let's say the last few years that I've been involved in medicine, I've noticed sort of a change in thinking from the diabetes perspective. So at first, it seemed like physicians are reaching for the sulfonylureas. Those are more commonly known as glipizide and glimepiride. So those medications would stimulate the pancreas to secrete insulin. So that was great. You know, you're getting more insulin, you're lowering your sugar, everything's wonderful. So there are a couple slight problems with that. Is that you're lowering the sugar no matter what. So if you didn't eat a big meal, but you took your glipizide and glimepiride, your sugar would drop, and then you'd have to eat more in order to keep up with it. So all of a sudden, the patient starts gaining weight. And there was sort of a transition in the ability of the ability of medicine to help the patient avoid this weight gain. So for the first start was the dipeptyl peptidase 4 inhibitors, DPP4 for short. Those were medications that slowed gastric emptying and decreased glucagon secretion. They're known as sitagliptin, saxagliptin, more commonly known as Januvia, and that was known as Januvia or Janumat and Anglyza. And then from that line of thinking, medicine sort of went to medications that will help patients actually lose weight. So there were 2 main classes that help patients lose weight. They're the SGLT2 inhibitors, and there are the GLP-1 mimetics. So let's just focus on the GLP-1 mimetics, because those actually have very good weight loss. Those are actually injections, and they help people lose weight by 2 major ways. They decrease the release of food out of your stomach, so it's what we call slows gastric emptying, and this way the food stays in your stomach. And also, almost more importantly, that it affects the hypothalamus, which is what we call the reward center in the brain, and it makes patients feel fuller.
Because eating is emotion.
Of course.
It's emotional.
When you're happy, you eat. When you're sad, you eat.
I'm a happy eater.
When you're like middle, you eat.
I'm not a sad eater. I'm a happy eater.
People eat no matter what.
Everyone knows that.
When you're getting these GLP-1 shots, per se, you start feeling better. And
can they do those right in your office? Not to cut you off, but you can do the shots right in your office, or is it the hospital?
So you can do the shots at home.
Oh.
Oh, yeah, no. So there's different formularies of the shots. Either you can do them. It started off with Byetta, and then there were medications similar to called like liraglutide, called Victoza, and then there were medications that help you lose weight more for weight loss, like Saxenda. And then now there's 2 types of medications that are more weekly injections, such as Trulicity, and Ozempic. It looks like we're running out of time.
Yeah, it's hard to believe we ripped through a half hour, but
we go fast.
It is. But how often do people have to have those shots? Does it
if you're on
case
the
by case?
Trulicity or Ozempic, those are once a week medications, and they're proven to have very good efficacy.
Mm-hmm.
So those weight loss drugs, which also help control sugar, obviously, are great for diabetics, and they help with weight loss.
Good to know.
And they're only once a week.
And I got to thank you so much for putting up with me, but also so much great information on antidepressants, sleep apnea, and diabetes. But we got to have you back on. Check out Dr. David Selzer, NYU Langone Medical Associates, 101 North Clematis Street, Suite 110, West Palm Beach. And then also in Delray Beach, NYU Langone Cardiology Associates, 16244 South Military Trail, Suite 560, Delray Beach. You can get all this info on nyulangone.org. And Dr. Selzer's number is 561-365-3000. Thank you again. We got to have you back on. I'm sorry to cut you off. We'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed